bed bath, the first thing we do is obviously knock, identify ourselves, and wash our hands and explain what we're going to do. We would go over to the resident, make sure that make sure that they're covered, and have the rails raised, the bed up, and then once we're in the position where we can work, we'll lower the rails. We would have a water basin 2/3 the way full with water, with warm water, and the first thing that we would do is go ahead and put the bath towel on them. We would then start with the face. We take the washcloth and make it to the hand, make it to the mid around the hand, and we want to start with the eye and work from the inside of the eye out. And then once we go to the other eye, we use a different part of the mitt, but also work from the inside out. Then we'll wash, rinse, and dry the face, the neck, and the shoulders as well. And then we would go to the arm. We would fold the towel over the chest and put the resident's hand in water, and then wash the hand, and then up the arm and the armpit, and then repeat on the near side. We would do the far side first. Then when we go down to the abdomen, place the blanket or the towel over the abdomen, and without exposing the resident, go ahead and wash the chest and the abdomen, and then rinse and dry it as well. We would then go down to the pubic area and lower abdomen and do the same there, keeping the towel folded over, but still providing for them privacy. So we lift the towel up and wash under the towel, and then rinse and dry that area as well. Then we move to the leg. So we would take the water basin and place it at the end of the bed, and lift their leg up at the knee and the foot, and place the foot into the basin and wash the foot and the legs, and then rinse and dry that, and then do the same thing on the other side. We would then go roll the resident onto their side and wash their back by folding the towel across their back, or lay a towel down below them, and fold the sheet or the gown over on their side and wash the back and the bottom, and then rinse and dry that as well. Then we would go ahead and we would have already emptied the basin with some clean water after washing the pubic area. Then we would lay them back on their back and wash their privates. If they can do it themselves, they would finish up the bathing process themselves. If they can't, we would put gloves on and wash that area, and then empty the water, and then dispose of the gloves and wash our hands. At that point, we would then apply the lotion and the deodorant to the resident, and give the massage or the back rub at that point as well. And then we would make sure that the signal light's in place, lower the rails, lower the bed, and make sure that they're comfortable, and wash our hands and record our results.